everyone. It is tremendous to have everybody out here today, and it's great to be here. My name is Nathan Neudorf. I'm the MLA for Lethbridge East and Minister of Affordability and Utilities. While I go around Lethbridge talking to the citizens of Lethbridge and Southern Alberta, one of the primary points of conversation that I always hear about is the need to improve and provide high-quality health care where and when people need it. And making it stronger, faster, and easier to access is one of the top priorities. And that's why it's great to be here today for an amazing announcement for the City of Lethbridge, Medicine Hat, and all of Southern Alberta. Joining me today are our Premier, Danielle Smith, Minister of Treasury Board and Finance, Nate Horner, Minister of Hospital and Surgical Health Services, Matt Jones, Physician Lead for Cardiac Sciences with Alberta Health Services, South Zone, Dr. Zaya Zelke, and Parliamentary Secretary for Rural Health South, Justin Wright. Albertans deserve the best healthcare system in Canada, one that is accountable, coordinated, and delivers high-quality care no matter where you live. Today's announcement is part of that work. We are creating a more modern and sustainable system while investing in big, important health services all across our province. And with that, it's my pleasure to welcome Premier Danielle Smith to share today's announcement.
Thanks, Minister. And in case you didn't hear at the beginning, just a few technical difficulties. I know some of you have cameras in the room, so if you want to pass on your question if you're not in the room to be able to get that asked, or text to Sam Blackett. I think all of the media has his number. But I am so happy to be here today with the Minister of Hospital and Surgical Health Services, Matt Jones, President of Treasury Board, Minister of Finance, Nate Horner, Minister of Affordability and Utilities, and of course MLA for Lethbridge East, Nathan Neudorf, as well as the man of many titles, the Parliamentary Secretary for Rural Health South. He's also Military Liaison Chief, Government Whip, and MLA for Cypress Medicine Hat, Justin Wright, and as well, of course, Dr. Zaya Zelke, Physician Lead for Cardiac Sciences in the Health Zone, to announce an important milestone in our efforts to expand cardiac and intensive care services in Southern Alberta. A week ago, up in Edmonton, ahead of Budget 2026, Minister Adriana LaGrange and I announced record-high funding for Alberta's doctors, funding that will support our amazing physicians and strengthen regional capacity. Our government recognizes that no matter what budgetary pressures we're facing, investing in the health of Albertans is a non-negotiable line item. This has been a top priority for us. The health system we inherited wasn't working for patients or care providers. It was freighted down with unnecessary bureaucracy that prevented care practitioners from doing their jobs. And it was unable to keep up with population growth that's seen us add nearly 300,000 newcomers in the last 5 years alone. Since we first announced our efforts to refocus healthcare in late 2023, we have been expanding capacity, cutting waste, and sending more resources to the front lines where they matter the most. In fact, since September, we have reduced the number of non-acute patients in hospital waiting for alternative levels of care by 23%. And I might just note that Dr. Zelke has been instrumental in that work. And we've reduced the number of patients waiting for continuing care by 40%. We've also been recruiting health professionals by the thousands. Since 2019, we've added 2,060 doctors, 12,000 RNs, 3,400 LPNs, 1,300 paramedics, and over 12,000 healthcare aides. We've increased surgical volumes in Alberta to record-breaking levels in 2024-25, completing 318,920 procedures and surpassing the target of 310,000. And we expect to set a new record in 2025-26 and are on track to surpass 321,000 total surgeries. But we know that there is more work to do to build on the significant progress that we've made in creating a resilient and responsive healthcare system that puts patients first. Throughout the process, our biggest priority has been ensuring Albertans get the care they need, where and when they need it. And that's why we're continuing our work to improve intervention and identify and reduce risks to deliver better healthcare outcomes for Albertans. That's especially true for cardiac care. Any illness involving the heart is a race against time, and the very last thing a sick patient needs is a long journey to a bigger, faraway center for treatment or diagnostic testing. We want to deliver faster intervention for Albertans in this situation and in other situations of acute medical need. And that's why I'm pleased to announce today that we're investing $59 million over 3 years to expand cardiac services and intensive care capacity in southern Alberta. Funding will be directed towards Chinook Regional Hospital here in Lethbridge and to Medicine Hat Regional Hospital. These are both important regional healthcare hubs in southern Alberta. They serve patients in the cities where they're located, as well as residents living in the surrounding communities and rural areas. Chinook Regional Hospital, for example, serves a catchment area of more than 150,000 people, and that includes residents of Lethbridge, one of Alberta's fastest growing cities, which has added more than 10% to its population in just the last 5 years. It also includes Albertans living across a wide geographic area for whom Chinook Regional Hospital is the closest major treatment center for their complex healthcare needs. It's been clear to our government that more capacity is needed, both here in Lethbridge and throughout the region. And that's why we previously provided funding to introduce a catheterization lab at the Chinook Regional Hospital and to begin planning for a Medicine Hat urgent care center. We've also provided $39 million for the University of Lethbridge Rural Medical School to provide more opportunities to train doctors closer to home in smaller communities. And the last several budgets have also included funding to support the planning process for the South Zone Cardiac and Intensive Care Expansion Project, including funding to enhance intensive care unit capacity in Medicine Hat. The investment we're announcing today will... I hope that doesn't involve anyone in this room. What we're announcing today will move this important work onto the next phases, which are advanced planning and early construction. Expanding their treatment and diagnostic capacity will enable Chinook Regional Hospital and Medicine Hat Regional Hospital to serve more patients in southern Alberta quicker and closer to home. It will result in fewer trips to other parts of the province for testing and treatment and shorter waits for the kind of care where every second counts. The bottom line is this: our government believes Albertans deserve access to life-saving care close to where they live. By hiring more care providers system-wide and by expanding our regional care capacity like we're announcing today, that's exactly what we're delivering. I'd now like to invite Minister Matt Jones to share more details about how this funding will be used to improve care in the South Zone.
Sorry, Matt. I'm going to go first. Thank you, Premier. And thanks to all the folks here at the Chinook Regional Hospital for having us here today. Communities grow when people have confidence that their essential services will keep pace with change. Across Alberta, communities are expanding and the need for timely, high-quality health care continues to rise. Meeting that challenge requires both planning and investing with a purpose. Budget 2026 is built around clear priorities, improving healthcare, supporting education, and strengthening Alberta's economy for the long term. Today's announcement reflects that approach in action. As Premier mentioned, through Budget 2026, Alberta's government is investing $59 million over 3 years to advance cardiac care and expand intensive care capacity in southern Alberta. This investment moves the South Zone Cardiac and Intensive Care Expansion Project forward into its next phase and brings specialized care closer to the people who rely on it. A new cardiac catheterization lab at Chinook Regional Hospital will significantly improve access to life-saving treatment right here in Lethbridge. It means faster diagnosis, earlier intervention, and quality care delivered closer to home. At the same time, expanding intensive care and diagnostic capacity in both Lethbridge and Medicine Hat strengthens the entire regional system. These facilities play a central coordinating role in southern Alberta's health network. These are practical investments with real outcomes: shorter wait times, reduced patient transfers, stronger regional health services that can grow alongside the communities they serve. Budget 2026 makes disciplined choices so we can continue investing where Albertans see and feel the most difference in their daily lives. Even in a deficit year, facing serious financial challenges, we are focused on building capacity that supports families today while strengthening the system for the future. Our responsibility is to build a health system that keeps pace with Alberta's growth and remains sustainable for generations to come. That's what Budget 2026 invests in. And with that, I'll turn the podium over to Minister Jones. Thank you.
Thank you, Minister Horner. Since you're paying for it, you can go first. I will keep my remarks brief, but I want to sincerely thank everyone who contributed to making this project a reality. And that includes healthcare professionals, community members, former patients. Your dedication to improving the healthcare system for the people of Lethbridge, Medicine Hat, and Southern Alberta is truly outstanding. Most of all, I want to take my time today to acknowledge the efforts of one special individual, Dr. Zelke. Dr. Zelke began her cardiology practice in Lethbridge in 2013, becoming the first permanent cardiologist in Southern Alberta. She currently serves as AHS's physician lead for cardiac sciences in our South Zone. Her extensive experience and deep understanding of the unique needs of cardiac patients in the region have been invaluable. Her clinical expertise and leadership and advocacy have played a key role in shaping this project, with a clear focus on delivering meaningful, life-saving improvements for care for patients across Southern Alberta. This project brings life-saving specialized critical care and increased capacity to Lethbridge, Medicine Hat, and Southern Alberta. With that, I'd like to invite Dr. Zelke to speak about the significance of these projects for her patients and the residents of Southern Alberta.
Thank you so much, Minister Premier. It is truly an honor and a real joy today to stand here as a cardiologist and a physician lead for cardiac services in the South Zone. Today is a historical day for cardiac care in our region, one that many of us have been advocating for and working towards for more than a decade. But I want to be clear, this isn't about just infrastructure and budgets. It's about patients. For years, too many patients and families here have faced a stressful reality. In the most urgent moments, care often means transfer, time on the road, and being far away from home and support and their families. Out of the many hats that I wear, being a cardiologist is the one that I cherish. Because as a cardiologist, you don't just treat a heart. You meet people, often in their worst days of their lives, when they're terrified, when their family is trying to be brave, and when the time suddenly feels like it's moving too fast, and you try to help. But the reality is that sometimes we can't save a life just because we don't have access to the same life-saving services locally that we need. I remember each of my patients that I have lost vividly. Patients who were too unstable to be airlifted, patients where the window was closing, and families who were terrified because they knew that the care that they needed was too far away. Those moments stay with you forever. And today, in part, it's about them. It's about their memory, and it's in their honor that we build a system where this happens less, and where Southern Alberta can get the right care closer to home, where minutes matter most. I also want to take a moment to thank people who have carried this work so far and got us to this point, because this has been a team effort. To my entire team, especially my longtime, now retired partner, dyad partner on the operations side, Marilyn Bartoshek, thank you. We have spent countless hours, nights and weekends, writing, drafting, building this plan to get it to this level. And now to my current partner, Kevin Riedick, thank you for your leadership and moving this forward every single day. To the South Zone leadership, Dr. Aaron Lowe and Dr. Stewart, thank you for the runway and the support to keep pushing this forward when it was hard. And I'm so grateful to the Cardiac Sciences Advisory Cabinet and my co-chair, Mayor Higgin, for being relentless advocates for this project. And not the least, thanks to the Chinook Regional Hospital Foundation and to our amazing community. You're not just fundraising towards bringing hearts home, you have helped create a movement that I am told is the single most successful fundraising campaign in the region's history, having raised more than $25 million and counting so far. This shows one thing, that our community in Southern Alberta believes that our families and our patients deserve world-class care closer to home, and it's coming. And finally, thanks to the Government of Alberta. Thank you for truly believing in this project and for investing in it. This project will save lives for generations to come. Thank you for being part of mending broken hearts and bringing hearts home. It is now my pleasure to hand over the podium to MLA Justin Wright.
Well, thank you, Dr. Zelke. Lethbridge and Medicine Hat play a vital role in our regional healthcare system. They support rural and remote communities across the southern zone. Investing in cardiac and intensive care capacities at these sites strengthen regional infrastructure and help ensure the broader health system remains stable and sustainable. By strengthening cardiac care, intensive care, and diagnostic capacities across southern Alberta, Budget 2026 will enable more patients and families to receive specialized care close to home. This investment reflects our commitment to building a patient-focused healthcare system right here at home, the right care in the right place at the right time. And with that, I will turn it over to Kyle for the question period.
That brings us to the end of the formal portion of our news conference. Now I'll move to the media question and answer. As a reminder to all reporters present or on the phone, please identify yourself, your outlet, and who you're directing the question to. We have time for one question and one follow-up. We'll start in the room here and then go to the reporters online. Yeah.
Hi, David Opinko for Lethbridge News Now. I have a question for Dr. Zelke. Sorry to interrupt your water. Does this announcement mean that the fundraising for Bringing Hearts Home is now complete? Or I guess what is the status of that? And what I guess are the next steps moving forward?
Yeah, thank you so much for the question. Our fundraising campaign, we have committed to fundraise until January of 2027. The support and the enthusiasm around the campaign has been incredible, as you have noted. We intend to continue to fundraise. That helps with the momentum of building these services, but also, most importantly, it raises the profile of cardiovascular care. As you know, our region experiences 30% higher mortality rate compared to the rest of the province. In part, that's a reflection of our cardiac risk factors in the community, 15.5% higher than the rest of the province. This is our moment to raise awareness, to raise funds, and to bend the curve on our outcomes.
Thank you.
Do you have a follow-up?
Not at the moment.
Thank you.
Any other reporters in the room?
Hi, Quinn Keenan, CTV News. I'm not sure if this would be better for the Premier or Minister Horner. I'm just looking to ask on the situation in Iran, in the Middle East, and just how the province is expecting this to impact oil revenues, and if there's any sort of ballpark initial estimate on how much oil revenues could be increasing as a result.
Well, let me just start by saying that we want the conflict to end quickly, with minimal loss of life. I think that's what we should all be hoping for. And we're watching with interest about what our friends and allies are going to need. There are, as I understand it, a number of ships that are anchored in the Strait of Hormuz and some threats about not granting passage. And if that occurs, that's going to cause a lot of disruption. But I mean, we're here to help. But part of the way in which we can help is, of course, with expansions to the West Coast pipelines. The fact that Trans Mountain allows for us to have a clear line of sight to our Asian partners in order to be able to assist them. The fact that there's already an expansion that has been announced, and it just underscores the need for our 1 million barrel a day bitumen pipeline to the West Coast, because if this kind of uncertainty continues, it just demonstrates that the world and our trading partners and allies need to have a stable source of supply, and that's what we are. Did you want to comment?
Yeah, I guess I could comment on what it technically means for the government's revenues, and remind everyone we still have another month of the fiscal year that we're in 25-26. At the Q3 forecast, we determined that in the range that we are predicting budget 26 and ending this year, that every dollar change in the price of WTI was about a $680 million impact. In budget 25, when we were at a higher level, it was more dramatic. It was about $750 million per dollar. So, you know, since the markets opened yesterday, obviously been watching. It's been between 70 and 74, so a fairly dramatic increase. We'll continue to monitor that. We want to have conservative forecasts. We do want the potential for upside for the province. We don't want to overestimate that to make budget day go easier for myself and the government. I would much rather the actuals at the end of the year be in a better position. But very much the markets are pricing the risk right now. If the strait remains closed for a long time, you'll see that reflected in the price. But as the risk dissipates, it will quickly become a supply and demand calculation again. And you know, that's what led us to our forecast in the first place.
Do you have a follow-up?
Yes, just on that same topic. The recently announced budget, could this impact that in any way, and when could we possibly see any changes with that as a result?
The budget's printed. We put that out there. We will make adjustments. So like I said, we'll continue to monitor, and we'll give a more wholesome update in August at our Q1 report for budget 2026. You'll get the annual report for the actual year end of the fiscal year that we're in the end of June. But no, we set the budget. That's why we need to have conservative forecasts. And then if we are in a better position, you know, we obviously take that. And if we're in a worse position, we deal with it.
Thank you.
Yeah, the place to look would be the final, because as the minister mentioned, we're still in the last month of Q4 of last budget year. And so in June, we'll be able to see what kind of impact this month of volatility has had. But I suspect, not speaking out of turn, I suspect that rather than a $4.1 billion deficit that we were projecting in the budget, it might be somewhat less than that.
Thank you. Go straight ahead.
Justin Sibble with Global News. Question is just regarding cybersecurity with this whole situation. I know that oil and gas is considered to be kind of a higher risk. Same with healthcare, actually, is high risk as well. Is the province doing anything on that, maybe helping industry partners to make sure that everybody is kind of safe and secure at this time?
Yeah, well, I can tell you that if you want to do a follow-up, the best person to talk to is Nate Glubish, my Minister of Technology and Innovation. I think last 3 years running, we've given awards to his internal cybersecurity team. I think it's a team of about 25 individuals who work with the private sector to make sure that we have the best available technology in order to be able to stop any threat that may be coming our way. You acknowledge for good reason healthcare and our oil and gas resources. There's no question that we would potentially be a target, but I feel really confident at the robust response that we have. But if you want to follow up a little bit more on that to see how much more Minister Glubish can tell you, it's a constant monitoring exercise and has been for several years.
And then just on today as well, how important was the Bringing Hearts Home campaign as kind of visibility for the government to know that there are people like, we just had $1 million donated from a private business a couple weeks ago, I think it was. So how important is it to see that to maybe make sure that you guys know that, yeah, we absolutely do need this here. The community is absolutely asking for this.
Well, I might let either Dr. Zielke or Minister Neudorf respond to that, but I can tell you one of the things that we value so much as a government is all of the work that various hospital foundations do to identify the need in the local community and to begin the process. I can tell you that since Minister Jones has come in, he's signed off on a lot of yeses for the initiatives that have taken place at those foundations. And this, to go to Dr. Zielke's point, our whole strategy from the start has been let's get critical services closer to home so people don't have to travel. And I think the numbers that she shared just are heartbreaking, and we want to be able to see if we can have an impact on that. We know that there has been this push, just go to Calgary or just go to Edmonton. We're sort of pushing it back. Let's saying, what can we keep in the large regional hospitals so that people don't have to go to Calgary all the time for life-saving care? There'll be some things that you can only get in the big hospitals, full service in Calgary and Edmonton. But I think that the campaign and Dr. Zielke have been passionately advocating that this is one that has to be close to home. Did you want to comment, Minister?
Thanks, Premier. Yeah, it's incredibly important for local voices to share the importance of these initiatives. And in general in society and in these hyper-politicized conversations, to have something like this that is about patient care and individuals, that is not about politics, having a community make their voices heard by a commitment of their finances, a commitment of their time, makes it a really easy decision for government to support that and make that work. And many of you live in Southern Alberta, have for a long time realized there are pockets down here that feel like we're forgotten in Edmonton. So when the community rises up, it definitely helps local representatives to share that voice and clarify the priorities of the region. So Parliamentary Secretary Wright and myself and our other colleagues in the South being able to have a rallying cry that is community-led just makes it a much easier decision at Treasury Board and at Cabinet table to see these kind of projects proceed.
Thank you for that.
I might just get Dr. Zielke to comment, because for those who are not technical, I think it might be helpful to know what additional services you can do with a catheterization lab here that you wouldn't be able to do before, and what people might still need to go to Calgary for.
Thank you, Premier. So our vision has been a holistic wraparound cardiac sciences and cardiology care here in the region. So that means prevention, intervention, and as well as diagnostics and recovery and rehabilitation. Currently, we do not have access to coronary catheterization laboratory. That is where you do diagnostic testing to take a look at the arteries of the heart to see how close they are, or how, and what kind of intervention is needed, as well as measuring the pressures inside of the heart when there are diseases of the valves within the heart. This is also the same technology that is used to open an artery when it's blocked and someone is having a heart attack. So it is very critical, especially in the type of heart attack where you have complete and total closure. Right now, what we do at this center is we administer thrombolytics, so clot-busting medication, and we ship the patients to Calgary to open the arteries as needed. That carries risk, it carries cost. You also have the cost of and the time of our ambulance services being on the road, and it delays care, and it's sometimes not successful. At some points, and there are cases, as I mentioned, the patients are too sick to airlift or to transport, and those are the gut-wrenching cases whereby if that individual was in a bigger center, they would be provided care. But to answer your question about the fundraising, it has been absolutely foundational to advancing cardiac care even now. So for example, the Yule Foundation in Medicine Hat has generously donated $5 million towards this campaign, with $2 million earmarked towards a prevention campaign. We have also had matching donations on the Lethbridge side for the same, which we have taken and have ran with. We have written a plan and a program for what we call Southern Alberta Prevents, to try to bend the curve on our risk factors in our population. That sits with the Primary Care Alberta right now, and we are working with them very closely, and we are so excited. So the money that we have raised as a community is already having an impact. We don't need to wait to stand up all of our programs. It has already begun, and it's going to change the way that we practice, and most importantly, and at the end of the day, what matters the most, the outcome for our patients.
Thank you. We'll go to questions received via text. The first one is for Premier, from Lisa Johnson from Canadian Press. Can you expand on Rob's tweet indicating that the government is already starting to work on implementing immigration changes should the referendum give such a mandate? How many FTEs are needed to be hired to perform immigration vetting? Do we have an estimated cost?
Well, I can tell you that you'll see a bill coming forward in the spring session that begins the process of providing more support for temporary foreign workers who might have a grievance, because we do hear from time to time that there are individuals who are recruited, and then when they arrive at the job site, the job is not what they expected, and the pay that they're getting is not what they expected. And so we want to make sure that anyone who is coming here with a job, that the employer is living up to their commitments, number one, but also make sure that immigration consultants are regulated in a way that we can also ensure that they do not have any practices that are giving misinformation. So that would be the first step that we're taking. We heard that from our Multiculturalism Council, that addressing issues that temporary foreign workers are facing of having that mismatch in promises versus expectations is one way to start. And then there'll be other things that will roll out depending on the result of the referendum.
Thank you. Her follow-up was, when can we expect the government to define some of the specific terms of the referendum questions, including what an Alberta-approved immigrant is, what a reasonable fee is, et cetera?
Well, we certainly will have a public communications campaign as we finalize those questions and ready them for the ballot with Elections Alberta. And so we'll have to maybe get Mickey Amory to follow up with you on what it is that the steps will be for when that gets formally affirmed and announced, but we would have a full public relations campaign so that everybody understands what it is that they're voting on.
Thank you. The next question is from Will Vassar from Western Standard. Reports have said that the NHL commissioner was coming to Calgary today to tour the arena site and discuss City's bid to host the 2028 World Cup of Hockey. Has the provincial government committed any funding to the Flames/City of Calgary if they were to be selected as host?
I believe we pledged $15 million to assist with the bid. You can double up and check with Minister Boychenko, Andrew Boychenko on that, but it would be exciting. I understand it's a joint bid, and so both Calgary and Edmonton would benefit from it. It'd be 2028, and so it would be right after the new event center is open in Calgary, and it would be, I think, mid-year on Olympics. It's going to be, I think, the second most watched sporting event in the world when it comes to hockey. So we're crossing our fingers and hoping that the NHL Players Association, as well as the owners, make a decision for the Calgary-Edmonton bid.
Thank you. Will's follow-up question was, what would be the process that needs to happen before the government would consider adding a provincial sales tax question to the October referendum or any future referendum?
Well, I know anyone who proposes a provincial sales tax says, why don't you just put it on a referendum? And I say to them, why don't you start a citizen initiative? If you think your fellow citizens are so keen to have a vote on this issue, we have a process for that. And there's time, because what I've said is that any citizen-initiated petition that gets the requisite number of signatures will also be able to go on the October ballot. So I would say that all of those voices that are asking for it, then maybe they should put their boots where their mouth is and go out and try to get some signatures if they're so intent on it.
Thank you, Premier. The next question comes from Emmanuel Prince, Radio Canada. To the Premier, multiple members of the national security community are worried about the threat of foreign interference in Alberta's upcoming referendum in the fall, in particular if separation is added to the ballot. What measures has your government taken to prevent foreign powers from interfering or influencing Alberta's democratic processes?
Well, one of the things that we are doing is that we are adding Canadian citizenship to our driver's license along with the healthcare number. So that, as I understand it, is rolling out as soon as May or June. And I hope that Albertans, even when they're mid-cycle on changing their driver's license, will take advantage of the reduced rate that we have to go and get a new driver's license so that we can affirm the Canadian citizenship. And then, as you saw, we are also having a referendum question asking if citizenship should be a requirement of the next provincial election. So even those who might not have been able to update their driver's license, asking Albertans if they think that's a reasonable thing to do. So we take the concerns that have been raised over the years about foreign interference in our elections very seriously, which is why we had already begun the process a couple of years ago to add these additional measures. And if we see any indication that that's going to be the case, that there is going to be interference, then we will take additional measures.
Thank you, Premier. His follow-up was, we're now at a point where 14 of the 24 recall petitions targeting UCP MLAs have been tabled. And as far as we know, they've all failed to gather the threshold to force a recall vote. You are yourself facing one a medicine hat. What do these results mean to your government? Was it ever, in your opinion, a credible threat for the members of your caucus?
We have these mechanisms so that people have the ability to express their concerns about issues of government policy. And I know that there was a lot of concern when we used the notwithstanding clause in order to end the teachers' strike. But we had to make a choice about balancing rights. The ATA had been out for 3.5 weeks. Kids had been out of class for 3.5 weeks. It was affecting their right to have an education. And so we made a choice. And it is the right of citizens to be able to gather and tell us that they disagree with that. And so what I take from the results I've seen so far is that there was initial concern, but I think people are relieved to have kids back in the class. Parents are relieved to have their kids back in class. I think teachers are relieved to be able to be teaching again. And I think we've demonstrated with our actions that we heard the teachers loud and clear on the issue of aggression and complexity in the classroom. It's why we rolled out 476 complexity teams with a teacher and 2 education assistants. And it's why we've announced more complexity funding that will not only continue those teams into next year, but also add more. So the process that we go through in bargaining is always very difficult because we're not able to explain everything that we want to do while we're in the middle of bargaining. We were glad that that got over so that we could get on to the real work that we know teachers care about. And I hope that the results just demonstrate that, that people are feeling that we listened, we heard, and we're moving in the right direction, even if they disagreed with the way we went about it.
Thank you, Premier. The next question is from Rahim Mohammed from National Post. What makes lessening restrictions on access to nicotine pouches a government priority, given all the challenges you're facing right now in the area of healthcare?
Well, I think he might be referring to a letter that Dale Nally has penned that addresses an issue that we've been hearing of ever since they changed this policy in 2024, and it is a health issue. It's a bit strange to us that you used to be able to get smoking cessation products at the same place as you got smoking products. So now it's a weird situation where you can get tobacco and you can get chew and you can get vaping products at one location, and then you have to go to a pharmacist and get a smoking cessation product, which is a nicotine pouch, only through that mechanism. So what we're looking at is how do we best support those who want to quit smoking and quit chewing tobacco, which we know have a very high and recorded level of risk of cancers, of death, probably of cardiovascular disease as well. And so we want to be able to provide those alternatives in a way that's convenient for those who are seeking to quit smoking. So that has been something that he has identified for since the policy came into place, and I believe he's written a letter today on it.
Thank you, Premier. Rahim's follow-up was, are there any provincial levers to go around the federal restrictions on nicotine pouches?
I don't think so. Otherwise, we might have already done so, because for the reasons I just mentioned, we just think it's good health policy to make smoking cessation products more available as opposed to less available. But it's always better, if we can, to work in conjunction with our federal counterparts. We've been pretty successful at persuading them on a number of issues, and that's the process that we're going through right now, is to see if we can come to a meeting of the minds on that.
Thank you, Premier. The next question and final question comes from Miriam Valdez-Carletting from CTV Edmonton. For the Premier, can you explain the purpose behind creating the health shared services in this year's budget? It's a corporation overlooking the other health agencies. Is this not recreating AHS in a sense? Why is this needed?
There's a difference. I mean, with AHS was all things. It was the purchaser, it was the provider, it was the contract negotiator, it was the overseer of performance, it was doing primary care, mental health and addiction, it was doing continuing care as well as running hospitals. And that was what the refocusing was about. Let's get AHS running the hospitals that they have authority over. Let's get Covenant running their hospitals. Let's get charter surgical centers running their hospitals, and then let's create a body within our government that is going to be able to oversee all of that. So there are a number of shared services. There's when you talk about what are shared services, well, it's the HR function, the payroll function, the IT function, the administrative function. Those are all shared services between those, and we want to make sure that that is available to all 4 of the new service providing entities, but that we can also streamline there as well. As I understand it, I think there are about 11 or 12,000 employees that are in that cohort, and we want to take a really close look at that and see if that structural alignment is the same as what we have in government as a whole. Because as you know, government as a whole, we have all of these functions as well. We have payroll, and we have contracts, and we've got HR, and we've got IT. And so that's the next process that we have to go through, is just making sure that there isn't redundancy and overlap, because the principal goal of everything we're doing is to have fewer people in those administrative roles and more people in the frontline roles, like doing the kind of work that Dr. Zelke is. So that work begins in earnest this year. Did you have anything more to say about that?
Yeah, sure. Thank you for the question. The purpose of the refocusing is to put a dedicated focus on the different areas of health. So you look at prevention or primary care, acute care, mental health and addictions, and continuing care. They have a greater focus today than ever before. We don't want to lose the benefits of the supports behind a complex integrated system. That's really what the Health Shared Services Organization is. It's a recognition that we can be efficient by having common resources that all of these entities need in one area, so we don't have to duplicate it across all of these entities. But again, just in my area, I see the benefits of the refocusing in areas like cancer care, where we have a dedicated public health corporation focused on cancer care, and Give Life Alberta. I think you're going to see exciting things over the next few years with the dedicated focus in these areas. Thank you.
For the follow-up from Miriam, is from Minister Jones. Can we get an update on the ER doctor triage physician program? This was delayed last month, so some of the issues need to be worked out. When will this happen? Is HSS Health Shared Services part of this?
Thank you. So the question is referring to the triage liaison physician role, which has been approved at the Royal Alex Hospital and about 5 other hospitals. Currently, the position has not been filled. The ED section of the AMA has requested further increases to compensation and changes to compensation structure, and that will be negotiated alongside the agreement by Primary and Preventative Health Services with the AMA beginning in March. So it's my hope, certainly, we all agree that this is a position that would be beneficial to patients, which is why we immediately got it approved and why we immediately committed up to $20 million for this to be rolled out at 9 sites over the next 2 years. And now we're just at the point where there's a disagreement on compensation, which we are working through in a collaborative spirit with the AMA.
Can I just?
Yes, you may.
Can I just add, we keep getting asked that. I would just suggest you ask the AMA. Because as you can see, he's answered it many different ways at the same time, but it comes down to you have 2 partners in bargaining. So I would encourage you, you've heard the minister's answered, I encourage you to ask the AMA.
Thank you, Premier. Thank you, everyone, today. That concludes the time we have available.
Thanks,
if you have any additional questions or follow-up, please don't hesitate to reach out to me.